Welcome to KIMEcast, where we break through and cut the BS in sports medicine, rehabilitation, and sports performance, and talk about how things really work.
And welcome to KIMEcast. Tony Mikla, Russ Dunning, Evan Hauger's back. Evan, good to have you, brother.
Thanks. Fun always. There was no you last time. It was just Russ and I.
Yeah, it's true. I guess
First ever.
Maybe that's what it is.
Yeah, right.
Either way.
Evan's on like performance enhancement right now. He's like supercharged. Peptide therapies. He's growing as we speak.
Absolutely.
I actually feel like tremendously better compared to a week ago. We talked like, look, I'm sitting.
Yeah.
Like last week I was all.
So, yeah.
I'm tremendously better.
Wow.
And you've been doing the peptide stuff?
Mm-hmm. Yeah.
He was on it right away.
Yeah, I got it like 5 or 6 days out of it happening. I was like, all right, I'm going to be a science experiment. This doesn't feel good. I'm going to be a science experiment. Let's see what happens. And, you can't really ever say that that's the root cause of feeling better. There's got to be a lot of pieces to this, but I think this is moving way faster than I thought it would. And so it's BPC-157 and TB-500, the two peptides, and you take the TB-500 twice a week. And so the 2 days where I take that, the day following, I actually like feel amazing. I just shot that this morning, so tomorrow should be like an even bigger.
Yeah, sweet. So let's talk about that, because I think that sounded, I think, bad to the world, if you will, and the fact that like hey, I have back pain, started this right away, and now I'm Superman, which isn't exactly the case. I'm sure there's a tremendous amount of other things you've done as well, which is where research always goes wrong.
Yeah.
So I'd love to hear a little about that. So you had the back pain start like a little over 2 weeks ago.
Yes.
There was an incident or no incident?
Yep. Yeah. Well, so this is what we did the whole podcast about last week. But yes, played pickleball, and then like one step lunge twist, back exploded.
Yeah.
And like a electricity down the leg, like literally couldn't put weight on my right leg for 2 days. And it slowly was getting better, but then there was like a point. So that was on a Saturday. So there was a point on a Wednesday where it started to get like tremendously worse, and I like lost control of my foot, like my foot drop and get my heel off the ground. And so then that's when I kind of jumped into this. So then by Friday that week, started the peptides, and my foot was working Sunday. And
what are the movements have you been doing then?
So this is another thing we talked about a bunch. So I spent a lot of time in extension because it was extremely flexion sensitive. So from day one, like as much time in extension as possible. And I was joking this last week, but it really hammers home the importance of that directional preference, because I can hold a Roman chair for 90 seconds, but I can't put my own shoes on.
Yeah.
So that's like a pretty...
But you've been still doing that. You've been holding like a 99% extension life with a hard avoidance, or have you been starting to dabble in a little bit of flexion?
Small amount of dabbling, but still, I mean, this is still really fresh, and so I don't really know what to trust about how much better I'm feeling. So I still hold an extension, and if I don't, I will get like buzzing down the leg. But the weakness stuff is gone. That's been going.
Awesome. So yeah, so I mean, that sounds to me like the inflammation's reducing
very much.
Yeah. As it's reducing, the less pressure on the nerves and stuff.
And that's it, because it peaked when at almost exactly day 5, where you'd imagine that swelling and everything.
The inflammation would be the greatest.
Then, so that's why I wasn't. I mean, I was concerned, but not as concerned as I would be if on day 1 lost control.
Yeah. And then, so have you gotten to like done any child's pose or any like cat-cow stuff kind of things? Or
I haven't been spending much time in those positions, to be honest.
Yeah, just avoidance still right now.
Pretty much avoiding. But I can like tension. I can create tension on the front side. I can do like bear positions and like dead bugs. And I like carried my younger kid a few times. So I mean, I can create some.
You can be strong in a pillar.
Yeah. Which even like that first week, almost 2, I could not do like any tension. So sneezing the first 2 weeks was like, I thought it was over.
So you're following you're following the recipe really nice.
Yeah.
You're having extension preference. So you're doing extension motion, which would be like a prone cobra. Then you're also working on simple stability, through pillar, planking, bridging, pale off, carries, working on very simple spine straight pillar exercises, having a nearly complete avoidance of all flexion activity.
Yep.
And then you've been building up like simple strength, like kind of a tolerance
split
of
squats. I can that's the one way I can make my legs work is split squats. And so BFR was split squats, because loading it was tough. I could probably do a little bit now, but loading it was tough in the beginning. So I was taking the BFR home and loading up split squats.
So you're on like day 14?
Yeah, 16, 17. Yeah. Yes. Mm-hmm.
Yeah, right on cue. You're just kind of going through the basic recipe we have.
Yeah, and I have like 2 friends that sort of not simultaneously, but around the same time had similar injuries happen, which just speaks to, I guess, that point in life that I'm at now. But it's similar injuries at the same time. And they did
in your second level of youth.
Yeah. That's how young I am. That's how young I am. Yeah. Right. I realize who I'm talking to here.
Yeah.
So
the old people in the company.
That's right. You ever think you'd be the old?
No.
Well, yeah. But watching them not do the right stuff immediately, and they're like still struggling, and I've like surpassed them, and with an injury, a month and a half later, and I really don't know how much the peptides are actually helping, but I think doing the right behaviors from day one has been
massive. I think that's a real good point. Just talking about back pain for a second, I think, especially when it's acute, it's out of the blue, somebody acute like this. I think inflammation management is the key to success, right? Absolute key to success. So your two keys are you found out you have to avoid flexion, which is pretty obvious for most people, and they kind of do as well, but you know more than most of exactly how to avoid it. And then, did you take any anti-inflammatories and stuff as well, or just got with the peptides?
I did for 2 days. So I did on Wednesday. So that Wednesday was like 5 days after when my foot stopped working. I was like, I was trying not to do it, and I was like, I feel like I have to. Yeah. But that's probably the thing immediately that kind of got relief on that. Because if it was fluid pressure on the nerve, then that's probably the main deal.
Yeah.
But yeah, it's like 48 hours.
Yeah, I think some sort of like ibuprofen or Aleve or something, whatever works there. And then it's really cool to hear that maybe the peptides even contributed even more to this management option.
Right.
And then now it goes into like, hey, start building some easy movement back and building it up. But just to say this, I think that back pain is so poorly managed in this fashion. Like what you did obviously is all the right choices. And what we've done in like professional athletes is much of the same thing, but usually we'll do recommend like a prednisone injection or a Medrol dose pack or something like almost immediately. Like on day 2, it's like a 5 to 7 day run. And I've done this with several other clients that it's appropriate for, where they tell them go to their doctor, talk to them about this option, see if they feel confident with it, the doc feels confident with it. And most of them are all over it. And it's though prednisone's a really strong anti-inflammatory drug, makes this unbelievable shift where like a drop foot gone, a swelling and back pain gone.
But the behaviors are still critical.
Yeah, you still got to
use on his 3rd dose pack because he's not doing all.
Because he doesn't know how to avoid it from becoming inflamed again.
Exactly.
Yeah.
And no one can. I think people lack a proper visual. And so when we pull up any kind of like anatomy app on your phone and we show people like, hey, here's what the disc looks like. I think reminding people that the disc is made out of fibrous tissue, like a ligament that surrounds the disc. And so when you have a disc injury, imagine those fibers ripping as if you tore your ligament in your knee or you tore your ligament in your ankle. I actually oftentimes will say it's kind of like an ankle sprain. It just happens to be around your disc, which then can kind of push out into the nerve space. And so when you think of it like, hey, you rip those fibers, and I think that sets a certain visual in mind. And then after like 14 days, hey, I'm feeling better. Like, okay, hey, you think I should do these things? Well, if you did indeed rip, that'd be like ripping your ankle. And then day 14, like, now I want you to kind of make your ankle all crooked and jump on it 50 times. Are you that good? And people would say like, well, no, I'm not that good. I wouldn't want to do that on a sprained ankle I just did 2 weeks ago. Like, exactly. So that's why you need to still kind of like be nice with certain movements, even though you're thinking like, hey, I'm out of pain, I'm doing well. And this is where people get injured again. And because I think when you think about that ripping tissue, now once it's mended, it has to get strong. And that takes time. And how do you signal strength? You got to stress it progressively. And without the progressive stress, you don't get the strength. You don't get the signal to the fibers to be strong in certain positions. So that's what I think people forget is like, oh, I'm out of pain. I think I'm good to go.
That's where you end up with the chronicity of it, right? It's like in your case, you're getting better. So if you weren't who you are, you'd start to get a little more confident. And over the next 2-3 weeks, you're a little more and more confident. By 6 weeks, maybe you feel like, hey, I'm pretty good. I'm 80%, and then you kind of just go about the life. And as you go about the life, like you just move on, but then you're really, really vulnerable. If you don't build the strength back up or get because that tissue is maturing, it's laying down, but it's not getting enough stress placed on it to actually like be strong, tolerate these motions in the future.
I think the way you said that was really, really, I mean, that just highlights to people so clearly how potentially vulnerable they are and how unsafe it could be to push beyond the limits. And when you don't have pain as a guide anymore, when the pain is a lot better, that's exactly why I'm still avoiding those positions, because I know the healing timelines and I know that I'm not there yet. And so this isn't the time to go pick my bigger kid up from the ground, which says her legs don't work. She's 4. When she says her legs don't work, I can't pick her up.
Yeah. You're doing a sport squat and bringing her close to you.
That's it. Yeah, that's it.
Yeah.
Yeah.
For sure. Yeah. And then, unlocking the body, progressively working into more, a flexion pattern, which is a bent forward pattern. You're progressive. And what does that look like? Well, looks like going from kindergarten all the way to grad school. You just kind of walk your way up the movement stress and don't skip a step. And, if you want to, I think when people suffer the way you just suffered, you don't want to do it again. You don't want to say, hey, I think it's worth the risk of, no, let's actually have can we do this 100%? I don't want to misstep.
Yeah.
And that's what people look for is they want that journey to climb, whether or not it takes, 8 weeks or it takes all year. I had a guy when his leg stopped working and he was like, that was devastating. He, grown man walking with a cane to soccer practice. He's like, Russ, I can't even live right now. It's been like this for 3 weeks. So when I got my patient to a better spot, he's like, how long is it going to take? I told him, if it takes a year, that means we did it well. You're going to progress for a year, because he was that bad. Now, maybe you're going to progress inside of 3 months because you know exactly what to do from the beginning.
Maybe, but even so, to your point from the very beginning, that's where I think the peptides could be dangerous because people will use them as a way, let's speed this up and let me get over the hump here real quick. But I for myself, I'm not going to, I can't think about it like that. It's maybe something that makes this process better, but I still have to be on that, that extended timeline.
We've learned that all the technologies don't really speed up the natural healing cycle. Best case scenario, inflammation cycle's in the last 5 days. It might last a little bit longer, but that's best case. And then once you re-aggravate it, you start the whole thing over again. So it becomes chronic inflammation. And then you get into this remodeling phase, which is going to be, or proliferation phase, which is going to be, 6 weeks, 8 weeks. I mean, it goes on forever, but it's really, really dense there for that period of time. And then remodeling is going to take months and years,
Right.
But people are hoping that they can speed it up by whatever it is. Using supplementation. Do I take more protein? Yeah. Right. Is it testosterone injection? Is it peptides now? It's always something. And it's not a lot speeds it up. There are things you can do to make the quality of it better.
So you're just I just think about it. I'm trying to make the environment there better for that same process to still then take place. What's the way to optimize the healing environment in your body for that same process to take place?
I think the challenge is that, let's just say there's 100% fibers around the disc. We'll say you only ripped 2% of them. Well, it might make sense that you need that much healing for the rest of it to stabilize and somehow hold together. But say you rip 30% of them, well, that process is going to take longer. So I think it's really hard. It's not like you can take it, do an MRI and see a partial bulge. So,
it's not that good. Yeah, you don't know.
Yeah. So it's really hard to infer, this is a 6-weeker. This is a 16-weeker. This one's a year. It's really hard. I think it's just, we're just guessing. We're shooting from the hip. But what we're not shooting from the hip from is the journey. And then the journey with benchmarks kind of gives us an idea if it took you a month and a half to return normal flexion and touch your toes, you're doing pretty good. That's a pretty medium timeline or a fast timeline. Maybe we can infer it wasn't that bad of a rip. But if it takes you 3 months to touch your toes, that was pretty going. That might take you, that's a 12-month rehab. So I think you have to look at the rate of progression through benchmarks. And that gives you the only way to kind of project in the future of how long it's going to take. Because then you're going to be the one saying, when can I return back to pickleball? And that's it. All we can do is lay out the journey and just best guess.
Right.
Tough one.
Right. But symptom guided based on the activities and the progression.
Yeah.
And while saying that's not precise and it's a guess, I mean, you're kind of dealing with real-time feedback. That's what we do clinically all the time. We're dealing with real-time feedback of the people in front and people coming to see you. And so that real-time feedback, I think, does make it kind of precise.
I think real time's good. I think post-activity is really good. Meaning, whatever motion you have right now, do something that night. Did it get tight? The next morning, did you pay for it? You're kind of looking at the post-activity because that's not so much of the pain's subjective. That's was your motion tighter? Could you not do a certain thing? And that gives you an idea of the tissue response, which I think helps us navigate without feelings. Oh, that was a 7 out of 10, but I'm a tough person. I can really withstand a lot of pain.
This is exactly why treating people twice a week versus once every 2 weeks is easier.
Yeah.
Because you get that more real-time feedback rather than you have to sort of make this projected into the future guess of what they're going to be able to withstand and how they're going to be able to progress.
You kind of have an if and then.
Yeah.
If your motion gets robbed from you by quite a bit for 3 days, let's bring it back and match. If you didn't feel any different the next day, let's move on to the next step. You know, you're playing this.
Even with all the experience, I said to people all the time, like, hey, this might be amazing in 2 days, and you might be able to like do, you know, 3 times more than what I'm giving you. But I don't know until we find that out. It might be that it takes 7 days to get the same effect. So we'll see what happens. But if it does get better in 2 days, then you can add these 2 or 3 things on perhaps. We're not going to see them for a while.
Yes.
But it's hard. It's amazing, especially with like the youth. I mean, I feel like the speed of healing is so tremendous there. But with everybody, you just never know. Like the healthier the person, the faster those results possible are. But it's tough to read.
Well, that's why protocol based, or if you go internet, what's timeline for these? It's all a bunch of BS, because you're like kind of averaging the whole human, like variation of just hormones across ages and genders and phenoms versus your slow growers. Like everyone's in the middle. It's a 6-weeker.
Yeah.
Like that's not human. That's not at all how it works.
Yeah. But it is about like how long is the inflammation cycle? Are you still in it, or are you out of it, or have you continued to get yourself back into it? I think is really the only time question that matters. And then the second one is like, okay, you're out of it, but have the tissues had time to actually like stabilize? Like if they actually healed and kind of be able to scar over to some degree. Once those 2 things are gone, then then it's all about progression. You know, time is no longer the thing. But so that's why I think when every surgery is like, once you get past 8 weeks for the most part after surgery, for the most part, you're pretty like, okay, like,
let's stress.
Yeah, some people are doing amazing at that point. Some people aren't doing so well. But at the end of the day, like most surgeons are like, yeah, you're 8 weeks out. So, whatever.
Right.
Do whatever the PT says. They don't really care.
Take what it gives you.
Yeah, exactly. You got to be able to take what it gives you. But you're outside of both of those acute windows. Yeah.
Well, right now, I'm sure you can appreciate that with this back issue you've had, if you use an avoidance strategy, for a long time, talk to us what you think about, the whole fatty back syndrome or the weak back syndrome. Tell us, you've had you can't pick up your kid on the floor. So
yeah, I mean, but I can still like train my back. Like I can do Roman, like anything in extension. I actually do really well. So like long lever bridges and Roman chairs, and I mean, I can work hard. Supermans, I can tax that stuff not from a load standpoint, but from like a time and conditioning, like local tissue conditioning standpoint. So I can push that. But it really does highlight the importance of that, though. I mean, I think what's the research on this? Like 2 minutes you got to be able to hold to.
Yeah, it's high. It's like
a really big number.
It's 167 seconds or something like that.
Yeah, like that.
It's almost 3 minutes.
And to be fair, I know for a fact before this happened, I couldn't do that.
This is for the Roman chair back extension.
Roman chair back extension, 167 seconds. I know for a fact before this happened, I couldn't hold it that long. Do you have that? You could do that for 167 seconds? It's long. It's a long hold.
But I'd probably struggle.
Yeah.
But I think I can get 2 minutes pretty solidly.
Yeah. So yeah, I think that's kind of probably right where I was too, a little over 2 minutes. But so yeah, I know for a fact that wasn't it before. So, does that play a role?
But right now, how often are you doing simple back exercises to keep your back strong during this time that you're avoiding flexion?
I mean, all day, whenever it fits. I mean, what's wonderful is I like exercise at work all day. So
show people you get in and exercise.
Just kids doing, prone isos on the ground. I'm holding a Superman, or I'm laying on my back in a long lever bridge. I'm doing it all day. So
that is key. That you get, if you had to sit for a while and get stiff, that's then you don't have to deal with.
Our quarterly meeting last week, like that was like 6 hours. I was insanely uncomfortable. I was like up and walking and kneeling, and I never do that, right? So I was insanely uncomfortable. But at work, I'm pretty good because I sit for 15 minutes and do some therapy, and then stand up and walk, and then go, demo a little exercise or talk them. Now I'm more talking through exercises, but I'm actually pretty comfortable at work.
Yeah.
And make kids, everybody picks up their own weights. I'm not getting it for them, but which is what I should do for the future.
And that's one of the biggest things in managing as a PT, like managing somebody else's like injury, is that most of the time they're going back to a life where they have to sit, or they do sit, but they have to sit
hard.
Desk, yeah.
If I had to sit at a desk all day, like it
would take months to get over this.
It would take months to get over this. I mean, even in my truck driving, like I take my kid's blanket from the back seat, roll it up, stuff it behind my back, dude.
Yeah.
Then
so if you lived an office life and you're on a computer 8 hours, what would you do right now?
Dude, I mean, I'd be talking to my manager about a stand-up desk. I'd be up. I'd be like taking meetings while walking with headphones. I mean, you'd have to really like modify your setup, I think.
Yeah. How often would you load your back with back extension exercises right now
Oh,
if you were not just doing
So
it.
yeah, where I'm at right now, I would do like heavier doses 2 to 3 times a day. Early on, I was doing small doses like every couple of hours, every hour.
Yeah.
So I'd do heavier doses.
We go back to what's the fatty back syndrome?
Yeah. I heard that from one of the doctors that no, this is one of our, this was
We'll know where to go with that.
this was
I assumed you meant like fatty infiltrate.
this was Dr. De Mesa. He qualified that. He found that when it comes to injecting PRP in the back,
Yeah.
that he found that injecting PRP in the muscular tissue can help reignite healing from a strengthening standpoint.
Oh, gotcha.
So
So it's like what McGill published, that like a more fatty infiltrates within the multifida and the muscle tissue.
yes,
Be considered.
yes,
You have more fat than you have.
yeah, and he
like that too.
he was citing
You guys
that
do it really well.
Yeah.
I can only imagine. So yeah, so you have a fatty back.
you have a fat back.
That sounds like
My kids are saying that. I think it's a term of endearment for the people. But
No,
but
the kids are saying big back. That's
what's
it
that?
has something to do with eating a lot. I learned it from my sister-in-law. I don't really know. It's something to do if you eat a lot. Like,
Big back,
I don't
fat back.
know.
I don't.
Yeah.
I definitely misinterpreted that one. But I think the story. I think the story has to fit. If the story doesn't fit, then I start asking questions. But I think the story goes: you hurt your back, so you avoid all forward bending activity. If you don't bend forward, you don't really give your back muscles that much to do, unless you do Superman holds and bridges and bridge holds and long lever bridges. You kind of have to do really specific exercises for the back because you'll naturally not want to use it.
Yep.
You'll be more upright, more vertical, which means those paraspinals are not that turned on. And so if you inhibit all activity and live life so that you don't use your back muscles, well, they for sure get weak. And then your body kind of like, unfortunately, sadly replaces muscle with fat. And you get it.
pretty easy to avoid because I'll say early on it was not super comfortable, but it definitely didn't. I mean, I knew I needed to do it, and it wasn't giving me like the electricity symptom, but it kind of hurt my back. So, but I knew to keep going, and it actually helped to keep going. But I think there would be like a point there, especially early on, where there'd be like a stop sign that they wouldn't know to go through.
People get scared, and especially if they get 2 or 3 bouts of reinflammation, they just get scared of all things. Like, you know what, I'm not going to do any of that. And then that fear then leads to massive amounts.
that shit happened to me like a year ago, and it hurt my back for those days. Oh my gosh. I laughed because I'm like saying like the example of like how people say it, right? I picked up my kid's backpack and I didn't even lift the thing. It was just the bend and I just zing and I felt it down the leg and I'm like, oh, here we go. I literally laughed in the moment. I'm like, okay. I'm like, no problem. I'll just do the stuff that I preach. I'll just go over and get on the floor and like start moving and I'll get out of it. I couldn't get to the floor. Like it'd be best if I could have fallen in the pool at that moment. The only way that I was gonna get down, I was like, oh shit, this is strong. It still wasn't like pain, like excruciating, but it was so strong. It's like your body just like locks, right? You have to go through it. Yeah, that was the first time it's ever happened to me. Oh my gosh. But yeah, I shook it in like 3 days, and then probably got a little care. I mean, it didn't like hurt my disc or anything. It wasn't that bad, but I definitely like had the inflammation cycle, got a lot better in a couple of days. But I had to fight like crazy because I knew I'm like I have to fight through this. I cannot let this thing beat me.
Mm-hmm.
And with knowing like what I was feeling and like that I didn't have any like thing to really be concerned about, that was that gave me the confidence like to push that.
I think it's a very critical part to really the back issue story is whether or not you have radiculopathy, which is pain down the hip and leg, or you don't. And when you have that nerve type pain, it really kind of sets you into a whole different category. And then if you're in that category, which is where you're in, right now, then you have to really discern whether or not this is like a straining of tissue that crimps on the nerve and gives you radiculopathy, or, oh yeah, you ripped your disc. And so those are very different timelines, so not so much the intensity of the sciatica, but definitely if you have weakness, definitely if you have numbness. If you have such severe sciatica that you have weakness or numbness, the timeline is extremely variable. If you don't have that, just like little zing, oh yeah, I think many people can deal with that really quickly if it's not discogenic, as like the older PTs will say. I don't have a lot of young people use that term anymore, but and I think that's why people kind of seek out MRIs is like trying to kind of get the news. Or am I doomed for the next whenever? Right. But yeah, fatty back, big back, fat back. I like fatty back.
Go with that. Let's see how you do. Okay, Jesse, do your thing. We're going to talk baseball with the intention to some degree.
Yeah.
What should we talk about in baseball? Do you have any particular interest?
Anything. You said you wanted to talk about throwing when we were with Sean.
Yeah. Where do we leave that off at? Like throwing program? Like not having like.
No, we didn't get into that. We left off. We didn't get into much. We really just kind of talked about the elbow, and
then kind of like
we didn't really get into
the stress of the elbow, and then on throwing, and then like, how would you get someone back from it? Might be the conversation.
Yeah, I think that's a good conversation. Yeah, and maybe understanding throwing a little bit better.
I have some philosophical thoughts.
I have
more questions.
Good. I have a philosophical thought.
I'll save it.
Good. Yeah, I have one that I woke up with the other night that I'm now going to present about, but like rotation across the lifespan. So you think like an infant, one of the first developmental things they do is they cross the midline, and that's cortical development on the other side. Cross the midline leads to rolling. That's rotation. That's like first growth.
Are we doing this? Are we capturing?
No, she's fixing the battery.
Should you like shut up?
Oh yeah, sure.
Unless you can repeat it.
I can repeat it, I'm sure. I'm going to have to teach it later, so I have to say it. So then, you like maximize rotation in the middle part of your life, right? So then the best athletic things we do, like a Bruce Lee kick, a home run swing, somebody sprinting, like all of that is an expression of rotation. And then as your life, so that's like your bell curve going up, and then as your life comes down on the other end, like the main thing those people lose, you look at the old person shuffling around, is they lose the ability to rotate. They get a rigid spine, their hips get rigid, their movement gets like, it takes much more energy expenditure to do the same stuff because they lose the ability to rotate. So we learn rotation early. That leads to walking, crawling, walking, all that stuff, running, which is all expressions of rotation. We express rotation athletically here, like at our peak, and then we slowly kind of, people like lose that ability. And I think that's like, if you look at a qualitative thing to movement, when movement looks pretty, they rotate really well and they control rotation really well. And when it looks clunky and rigid, like the old folks, they've lost the ability to rotate and they lose other things. But yeah,
I feel like that story is nice, but it's missing something.
What's it missing?
Right there. It's floating, but enough.
I think throwing.
I'm not even talking about throwing. I'm talking about rotation. But yeah,
rotation is a total body kinetic link.
That's it. Yes.
Which is similar
efficiency,
similar to sprinting. Total body kinetic link versus 12-minute mile jog.
Camera's not even on me.
Not total body kinetic link.
Huh? But walking, even it, your arm swing adds efficiency.
Has to become a fast walk, or else like doesn't demand it. Like that's like it's the most
efficient version of walking. Like your best version of walking, most efficient, is because your arms are.
Yeah, it's just not as much of a stretch.
Sure. But that still exists.
Well, yeah, that to me, it's like, bow and arrow.
Sure. That's Jim McGill's research talked about walking and why it was helpful for back pain, because it was those rotational slings, to a small degree, at a point where they can tolerate before they can tolerate bigger stress.
Yeah, but yeah,
it's not.
Well, we still have we have 90-year-olds that walk. You're talking about like this parabola of
but they don't walk well.
My mom's like 78 with a new hip. I think she's probably pretty good, but she can't rotate her shit though. So because she's so big. I don't know. I've seen a lot of people golf really effectively without they golf. Okay, they don't. I'm saying not win, but they
participate.
Yeah, they do golfing, but they're not great kinetic.
Well, you can't do the activity, but you're definitely not doing it at a high level anymore. Like your ability to do it at a high level, I think, is predicated on your ability to be able to separate and rotate.
100%. I was just saying that walking 100% level is not really like pretty low level.
But sprinting is. Yeah. That's what I was saying. But if we progress that to sprinting, I think the sprinting rotational demand is not discussed enough. But the forces when the pelvis is going straight forward linearly, the thoracic spine and the trunk is rotated pretty much at 90 degrees with every arm swing in a sprint fashion.
Yeah.
Things underneath 100 meters or 400 meters for sure.
I have a great still frame picture of that from these three guys sprinting in my presentation, where you can like see the thoracic spine swivel. It's from behind. You can like see this shoulder, but you really can't see the other one. All three of them are in the same.
Yeah. I have a phenomenal shot of Sonia Richards Ross, like from row 1 Olympic Stadium.
Oh yeah, you
Shot myself.
You've
That picture's amazing.
yeah, that is really good.
She's like running right by me and just pelvis straight ahead, and then chest like totally turned, head straight ahead. It's pretty incredible.
Yeah,
It's got rotation to the spine. So the reason why Evan Hauger is here and will continue to be our star guest in this area is that we have a phenomenal location that we partnered up with Optimal Athletes and with SSC's baseball club. And we're all work together there to really work with the baseball rotational athletes. So Evan leads up our rotational athlete programming, and he leads our fellowship program in this space of the rotational athlete, which is outstanding. So we want to talk a little about throwing. We met with Sean Robinson, Dr. Robinson, on here several weeks ago, and we talked a lot about the elbow and some shoulder stuff at that time as well. We wanted to like extend that to like, what do we do now? How do you take that athlete that might be recovering from a UCL or from a flexor mass strain or something to do with the elbow, some sort of elbow pain from throwing, or shoulder pain, and how do we take those next steps? So let's see if we can dive into that process a little bit. So maybe we'll start with maybe some of the clearance steps. Like, I think that's the biggest question. Like, someone got hurt or they're coming out of surgery. What would be the criteria that we can throw, that we should start? I just got this text Saturday.
Well, I think we should start with like what throwing is. So I think we got to understand that when we throw, we always talk about the demands on the arm, but the arm is a passive participant relatively in a throw. It's the whip. It's the end of the whip, really. So where does the energy come from? It comes from the ground. So when you throw something, or when you hit a golf ball, or when you hit a baseball, or when your feet are connected to the ground and you rotate powerfully, your feet scissor into the ground. So your back foot pushes behind you into the ground, your front foot pushes in front of you into the ground, and that's what starts your pelvis to twist. And then you get the kinetic linking sequentially up. So the pelvis, then the trunk, and the arms, and then the implement, the hand, the club, the whatever it is. And so you get this like compounding interest, or like exponential increase in force. So force you could never create with just your arm. So before we even think about clearing, we got to know that the arm is going to be put under stress that we like can't replicate unless we do. So I think that's an important piece of the puzzle. But if you want to get to clearance pieces, then, of course, they've got to have full range of motion. They've got to be able to pass all your sensitivity tests. So if let's just take the elbow, because we talked about that last time. So there should be no pain on a bounce home. There should be no pain in valgus. There should be no pain when you crank their arm, and I mean crank into layback, because when they throw, you just take a still frame picture of somebody throwing from the side, their hand is pointing behind them. So it's 180 degrees. When you guys measure external rotation on the table, it's like 130.
Yeah, the best you can get is probably in that zone.
Yeah, it's like the high-level throwers, you're going to see like 130 to 150. But there's an extra like 30 to 50 degrees you got to get. So, you crank. So sensitivity test negative, range of motion good, crank them in external rotation. If they can do all of those things, that's great. You can move on to next steps. So then from a strength perspective, if the arm is a whip, it's got to be able to withstand force. So then for males, we'll say external rotation strength on the shoulder should be 15 to 18% of their body weight. There's range based on, harder throwers, bigger people.
With elbow at your side.
With elbow at your side. And we've come to that as a test with this really interesting case study that a guy I have currently. So he's a professional baseball player, and he ended up with a suprascapular nerve impingement. So he lost function of his infraspinatus. So I think his max before that happened, I think he was at it was high 30s, touching 40 at his side, which is really, really strong. So after that happened, that kind of all progressed. There's a horrible long story about how he was mismanaged here, but he ends up at a point where he's at about 15 pounds at his side. But up here at 90 degrees, he could still pull like 33, 34. So I think there's a big way for the shoulder to compensate up here, and a lot more ability to use your rear delt and maybe some other stuff to help. So that's why I like the at the side test, because it's really looking at those cuff muscles, because we're most interested in that. Because what happens is when they release the ball, there's 250 pounds of force pulling the shoulder out of the socket. So the cuff has to hold the ball in the socket. So we need a strong test for the cuff. So 50% of their body weight at their side. So then in layback,
50%?
15 to 18%.
Yeah, 15,
yeah. So then he's back up to like 41 pounds now, which is great. We're good. He's throwing. He feels good.
Yeah.
So then another big chunk of the arm is the flexor mass that sits right over top of the UCL. Sean talked about this when we did the podcast really well about how it's very protective for the ligament. So with a high effort throw, I can't remember the exact number here, but it's like 50 to 60 pounds of force, valgus torque on the elbow, and the ligament itself can withstand like 25. So every high effort throw is enough to rip the ligament. So you need so then your grip strength here, how much your forearms can contract to help is a big deal. So then we're saying over 70% of your body weight for males throwing is what's needed there.
I think it's awesome. Like when you look at a lot of people out, like when they ask that question, like when can I throw? My elbow hurts. Pain free is kind of a thing, right? And then it's almost like, yeah, I could straighten it out almost all the way. It should be good to go. Like it's kind of amazing that like people like feel that way or like think that way. And then when we talk about it, it's like, okay, well, pain-free is clearly evident. And then those tests we ran through really quickly, like you could straighten it all the way, bend it all the way, lay it back all the way, really torque it all the way, basically, to clear all that. And then there are some really solid standards. Like, can you kinetically link? Can your shoulder speak for itself and hold its own ground? And then can your grip hold its own ground? And if those things are deconditioned, then you're really not, even if those other tests are negative, you're really not conditioned to throw.
Yeah. And then you have to take it even further and you have to introduce speed. So those are all slow things. Yeah. So now we've got to move fast. So then you go through, a variety of plyometric type activities with little weighted balls and other types of medicine balls. And some of that you get an insight into their kinetic linking because again, the arm's a passive participant. So yes, it's nice to be strong here to help withstand the force, but the main thing that's going to dissipate the force is the rest of your body. So the more efficiently and better you kinetic link, the less stress is going to end up on your arm to begin with. So that's really the meat here is the kinetic linking because I think
it's what happened in the first place.
That's probably what happened in the first place. Yeah. It's 86% of how hard you throw has nothing to do with your arm.
Yeah.
So that's,
Yeah, this goes in line with the research that shows that if you injure your leg, you have a higher risk of injuring your arm subsequent to your leg as a thrower.
Yes, you do. Yeah, and actually, it's even further than that. That if you're missing range of motion in your hip, just range of motion in your hip, you're that much.
So speak a little more about that. So the kinetic linking and kind of how do you paint that story in your head? We can say that phrase, but give us like a little more of an analysis of that.
So yeah, well, I mean, if you think about the joint by joint approach, and you think of there's certain chunks of the body that rotate. So we need to be able to rotate. So our hips need to be able to rotate. We need to be able to rotate a bit through our midfoot. We need to be able to rotate a lot through our thoracic spine. And we need to be able to have enough rotation through our shoulders. We don't have rotation in those key points, then the stress is going to go somewhere else. I mean, you see this in the knee ends up having to rotate. That's all the ACL tears in people that we see. When the shoulder doesn't rotate, and when the thoracic spine doesn't rotate, that's all the UCL tears that we see.
So I'm trying to visualize this as someone throws off the mound. Yeah. They all start in the same position. And they all end in the same position. Yeah. So it's kind of like what's happening in the middle.
Okay, perfect. So first off, I would say there's many different strategies for this. And so, there's different versions. Everybody's going to express their athleticism a little bit differently. Some people are going to be, more vertical in how they approach this. Some people are going to be lower to the ground and more horizontal in how they produce their force. But I think there's some non-negotiables that are important that you'll see. So, their first movement needs to be towards their target. And, that sounds so simple, but it doesn't happen a lot.
Totally.
That's a key point. You want to see the feet scissor. So essentially, like your back foot is pushing you forward. And when your front foot touches the ground, your knee. So this is really great with that kinegram concept that you guys talked about on here at one point. But you can basically take, your cell phone, take a video of somebody from the side. So their chest is facing you. They're throwing, to one side. And you can hold your finger on the bottom and you just slowly slide across. And you get to see all these still frames of them throwing. And once their front foot hits the ground, that knee should never move forward. It should stay where it is or move backward. And that's a good sign that they are like pushing that foot into the ground. They're using all of the torque that they can get from their feet to make that kinetic link happen. And then, so that's that. Then, so that's the feet. Then that means the pelvis goes. Then you should see the pelvis, which is like their belt buckle should go first. Their sternum should come next. And then their arm should come through. When that front foot hits the ground, their hand with the ball should be higher than that elbow. And that's just you talk to all the baseball people in the world, and it's like a late arm that leads to problems.
So get more clear on that. So again, imagine if foot's landing, elbow is higher than hand. what has to happen? Elbow higher than hand, what happens next?
So if elbow's higher than hand, then they have to play catch up. So now they're slow getting into that like key position that we talked about, that layback position. That's the most important position in throwing. If they can't get to that position on time, then the stress is going to go to the wrong place.
Kind of like them hammering it into external rotation versus starting in external rotation.
Yeah, the velo, the velo, they'll have to be in the velo going backwards.
They kind of have to play catch up. So things aren't saved up enough, right? Their arm will lag behind, basically.
Well, they'll still get to end range external rotation. Just late.
Yes.
And that late then leads to like a jerk.
Right. So we got a timing problem. Yes.
So it's kind of like if you're going to take the arm to 130 to 150 degrees of external rotation, whatever the degree is, would you rather do it smooth or would you rather do it really jerky?
I mean, it's going to be a bit jerky, but yes, smoother, better. So
But it's like that, like the towel whip scenario, right?
yeah,
If you whip your buddy in the locker room with the towel, right, and you do it, and you get that thing to really snap, I mean, everything kind of did its job and it kind of went smoothly. You can still have it be effective and hit the dude hard, but it doesn't snap. And that's when you're kind of muscling it out.
yes.
And that's when you're most at risk is those situations.
Yeah, and a big piece of that, so you think about kinetic linking, there's kind of like three pieces. When you look at KVS data, which is the stuff you put on the hip, you put on the shoulders, put on the arms, you put on like a golf club or on your hand to throw. When you look at those things, there's three components you want to look at. You want to look at the order, so that order of hips first, torso second, arms, and then implement. You want to see the peak, so like the peak velocity or peak angular velocity that each of those segments can create. And then you want to look at the downslope on the other side of each of those arcs that they make. So the steeper the downslope, that's the better they're decelerating that first segment, the more of that force is going to be efficiently transferred up the chain to the next segment. So that's the towel. So the towel, if you just like swing your arm all the way through, you're never going to hit them that hard. But if you stop super fast, more of your force is going to be transmitted to the end of the whip or to the end of the chain. So you're going to get a more efficient.
The braking force.
Correct. Yes.
The braking force through your knee, then hip, then spine.
Yes. Which is that front knee not moving.
That
forward.
front knee not moving is a braking force about your knee.
Yeah, and I think calling it braking is like throws people off. So this is like a coaching thing. I think that gives kids and gives athletes the wrong idea. I think you have to think about that front foot as an accelerator because it really the higher velocity throwers and the better throwers, that knee actually moves backwards, which is them pushing that leg into the ground aggressively. So I actually think you have to think of it as an accelerator. But yes, it is like
because it makes it turn
because it's breaking your momentum towards the target, to your point. But I think you have to think of that leg as an accelerator.
I think it's awesome. Like nowadays, they don't show it quite as much in pitching. And like if you watch MLB and you're watching like a game or something, but sometimes they'll slow the pitcher down slow mo. But they do it with the hitters all the time.
Yeah.
Like if a dude hits a home run, I mean, you're guaranteed to see a side view.
Yeah.
Super slow mo of this exact concept, and they even say it like, here's the front leg. Here, watch the belt buckle go through. Then comes the shoulders. Then comes the bat. Like even the announcers, stuff. We were doing this 20 years ago, but now it's like super slow mo, like on the big screen. I mean, everybody knows what we're talking about.
It's like a joint lock. It's like a hard thrust lock. Thrust lock.
And because if you don't stop it, then that force is not nicely transmitted up the chain. So again, when you're looking at the chart, it's the order matters, and the order is everything. Without the order, you lose that compounding interest. Order, and then the peak angular velocity of each of them, and then the downslope on the other side.
Because if the energy isn't stopped, it just frankly it doesn't transfer up.
It just
you just keep rotating. You have to stop rotating for all that force to again go to the next one.
But it's hard to see with the naked eye when you watch Tiger Woods. Like I have old videos of him swinging the golf club, and one of the most powerful golfers I've ever seen. And so there is a point where where his hips and everything comes through where it stops, but then it just sort of continues through, and there's this smooth finish. And so I don't think people quite understand how important that
kind of like a lock and release, like a lock, but then
there's this
gets out of it
comfortable finish. But that lock happens right before his hands make contact. Everything is stiff and locked and like powerful contact, and then there's this smooth finish. And so when you look at it, it looks like this nice smooth thing because you don't actually appreciate how powerful it really is.
Yeah, but the difference isn't tremendous. Like in the individual rep, like. Let's say, what's a good exit velocity right now off a baseball bat? If a guy crushes it, like
I mean, 110 plus is
someone getting one. Yeah, and so some guy who doesn't hit it purely or doesn't have that, he could have an exit velocity of like 95 or 100. Like it's not horrible, right? It's just that when it happens and then you do it consistently, it's special. Number one, and then two, it's easier on the body, so you can do it thousands of times versus if you're getting like 105 or 100 and you're not getting the snap and you're muscling that then every time, then the failure point comes. Like if you're throwing 85 versus throwing 98 or whatever it is nowadays, right? That you got to get it to snap where it just makes it look easy. These guys that make it look easy.
Yeah.
All right, so here's my little caveat story, just like fun little. I'm curious of what your thoughts are. So I was at Dave and Buster's yesterday for my nephew's like birthday, and my brother-in-law had it all his guy friends.
But there was a speed tunnel.
Oh, for sure. So then there's that throwing. There's that throwing game. And these are all apparently ex-pitchers. So they were all college pitchers, and they're all like kind of like built guys. They're all maybe 6'2", 210, 220 pounds. So they're kind of bigger people. They're not like, round belly. They're just like little muscular people. Anyways, all four of them like, hey, we're going to go blow out our arm right now. We're going to do some max throws. I'm like, oh, I got to see this. This is going to be interesting. So I for sure thought like no warm-up whatsoever. All aged, 40-something ex-college pitchers go and just throw. They probably did 10 throws apiece at max velocity, but they all threw really interesting. I've heard you talk before, which I like to basically get this point of view, of your view here of a grounded athlete versus an aerial athlete. They were not aerial people. They were not light, tendinous, 6'5", long arm, that type of people. They had like good density, good handshake. They were built people. And the way they threw, they all kind of like really kind of gripped it pretty hard, and they really started like really firmly in full external rotation and kind of like mashed it through. And they all threw, and no one complained about their arm.
But did anybody throw harder than 90?
Hard. And what are we throwing?
Oh, like high 80s.
No, for 90.
They're 40-year-old men.
I'm just saying.
Pretty good.
I saw the winner got 87.
He's pretty good.
That's pretty good.
It's not like they're more than six. It was like 5'11", 6 foot.
Yeah.
So they kind of looked just like hardy people, and I don't know. Is that something? Like, do you see that throwers that are a little bit more grounded, lasting longer than throwers that are more aerial? And maybe you can speak to that. But I felt like by just feeling their handshake and seeing them, like, I don't think you guys will hurt yourself because I don't know, just the way they threw.
That's a really good question. I don't know that I've seen any data to support. I mean, I haven't seen
like Roger Clemens compared to like Randy Johnson, basically.
Yes, exactly. That's it.
Both had careers into their 40s.
Yeah.
Randy's like super long.
But those are the exceptions.
Yeah. But just to give everyone knows those two names, right?
Right.
Yeah.
But Clemens would be that guy, and he was that way. Like, just overpowered it. Very, very good. But Randy was very long and
whippy, snappy.
Yeah.
Super vertical.
Yeah, I mean,
both have so. Both, my point to that was saying that both you could have it either way.
Yeah, like none of these guys had a lot of laid back. They're not like the 150 that we were just talking about.
Well, that's because they're in their 40s and they probably haven't thrown that much recently. They probably all escaped sort of lucky with full sends after 2 beers deep.
Well, I'm not gonna make any phone calls today, so maybe they are.
Yeah, sure knows how they're feeling today. Yeah. Well, yeah, no, I don't know that I've seen anything comparing those two from an injury perspective, but I think it's a you approach rotation or really any sport with a completely different strategy. And I think forever, especially in baseball, there's always been, here's the way to do it. I mean, there was always like, the pitching coach has his way to do it because that's the way that worked for him. That's how he teaches all of his kids to do it. Every kid gets in a deep hinge and gets low to the ground because that's how he was successful in his, AA career or whatever it was. And I think that all of us as coaches and movement professionals could probably do a better job of taking what the person gives us and not putting square pegs in round holes and trying to figure out what does this person do well and then help them do that well. The current example of these two guys that are on polar opposite ends of this is Blake Snell, he's not pitching now because he's hurt, so maybe that's this to your point. But he's a very, very like vertically oriented dude, and like his legs almost don't bend when he throws. They're both like quite straight. But all those non-negotiables I said earlier, like he's still going to hit all those non-negotiable things. Then he had a teammate, can't remember his name, it doesn't matter, but he was the opposite. He was so low to the ground that his knee would drag on the ground behind him. I mean, both of them have had, I think, injuries at times, and both have been all-stars, and Blake Snell's won 2 Cy Youngs, and this other guy's been a Cy Young candidate. Name I can't remember. But they do it completely differently, and so if they both were tried to fit or put into the same box by the same coach, it wouldn't have worked. So they kind of, there's this spectrum maybe of movement, and I think we see it in all sports, basketball, soccer, I mean, whatever sport you want. I think there's this spectrum that we all live on, and we've got to figure out how to guide them towards what they're good at. Use the tools that they have
It's so funny you said that. Totally different topic of like mechanism, but the same concept. I was just meeting with our younger therapist that I'm mentoring, and we went over the step up test that we do. Like when you're looking at basically, the goal would be that someone does a pistol squat. So we looked at like, all right, when they're ready to do like step ups at a more aggressive level, can we get the femur higher than the hip? We get the knee higher than the hip to do it, you know? And one thing that she kept asking me was like, well, what if it looks shitty? Like, then what do we do? I'm like, well, that's the beauty of the test. If it looks shitty, it won't go. They won't be able to be successful because they'll fail. Now, if it looks shitty and they do get it to go, then you should ask a few more questions of yourself. You're like, all right, they figured it out. At the end of the day, if the athlete figures out the problem and has a solution to solve something that we normally would say that doesn't look good, but hey, they figured out a way to solve it and it actually works out for them.
What does that even really mean? It doesn't look good.
Yeah, it doesn't look good. Like, why do we put them in a box to say that's how it's supposed to look? Especially when you look at like, when you take it back to baseball, like the last thing they want is for all the pitchers to look the same. I think the guys are just doing
They figure it out. Yeah.
I mean, if you watch the playoffs, you see this in a heartbeat. Like once they've seen a guy more than like one inning, like it's just like BP out there.
Well, that begs the question: if there's a lot of variations based off somatotype, I'm thinking, triangle, upside down triangle, diamond, hopefully not a pair. So, I'm thinking something like that. So you have you have the somatotype variations.
Pair people can rotate pretty good.
Yeah, they spin like a top.
And then you have those that are a little bit more grounded. We can call them pushers. We can call them, strong squat people. Then you have those who are aerial. Maybe more they're tendinous. Maybe they're more kind of hamstring people. Maybe they're pullers. Maybe we have a little bit of separation. I kind of quickly made like 12 different boxes, so to speak. So if you can appreciate, there's maybe quite a number of variations of how people move. You said a great word. I think it's really important to kind of like hone in on what are the non-negotiables? What are the positions that we find success in? And what are the non-negotiables? And I think, we kind of center on like, hey, your rotator cuff needs to be, strong enough to decelerate because we know your arm's going to hit a certain speed. So if your arm hits a certain velocity, you better have the strength on the backside to slow it down, or else you're trying to like throw your arm out of the socket each time. What other non-negotiables are there?
But yeah, I think there can be movement non-negotiables. And I like the knee one, but I said the knee, and I said the feet scissoring and the sequencing. Another one is because they're all going to end up again that leverage position of layback with their arm is max external rotation right before it whips forward. Because we're going to measure it and it's 130 to 150 degrees, and it's going to be 180 when they're throwing. Their spine needs to contribute to the layback. So we should see a nice curve through their thoracic spine when they're in that position, because that's what gets their scap to tilt backwards, allow the glenoid to orient back, and actually gives them those extra degrees of throwing. And I think that's a huge key. That's something that Blake Snell being vertical and somebody else being completely horizontal will both do. So there are things that no matter the style, they're going to have to achieve.
Okay, so you said 3. The knee needs to not continue to move forward through the pattern.
First one I said is the first move is forward. So the first move is
first move forward.
Right. And then we should see the knee not progress forward once that front foot hits the ground.
Yeah.
Once that front foot hits the ground, the hand with the ball should be higher than the elbow.
Yep.
We should see a kinetic link. So we should see the order of everything.
Being knee gets straighter, hips rotate, spine rotates, arm follows.
Yep, exactly. Yep. We should then see the spine contribute to the layback position. So we should see a nice curve through their spine. And then once they let go of the ball, we don't really want to see, after they let go of the ball, we don't want the throwing arm elbow to ever hit straight. We don't want to see it go straight. Mm-hmm. So there should be a little bend in that. And all of those non-negotiables, all of those people will do when they're doing well.
Okay. Is that
no matter aerial or grounded or whatever?
Okay, so I know a lot of those kind of fit toward the pitching off the mound.
Yes.
Are there like similarities there to like other, throwing, hitting activities, such as I'm thinking like quarterback throwing?
Yeah, I mean, I think you'd take those kind of first few. So, like progression towards your target, you would take the feet scissoring in the ground, you would take the kinetic linking. I think you'd take all of those pieces. Yeah. But obviously everything minus the arm if you're hitting.
The hand is always up. The hand is always up in the quarterback. The ball should never drop. That's always.
Yeah.
You can look at all the stuff that Gruden does and like break it down. Like if that ball drops and it does like a big circle, that was what they hated about because of the time to cocking, it's slow, so you end up getting sacked basically. You want a long arm cycle, so it's here, and just kind of quickly back.
And those are like all timing performance things, and that's like the guys in the pocket. But now you see football is these guys like all these off script plays. They're running out of the pocket, the ball's at their side. I mean, Josh Allen's holding the ball down by his knee. I mean,
but see, the reason why he can do that is because he's so big and strong.
Correct.
Like his hand is so massive,
so big,
and it's non-likely that it's going to get knocked out, right? Possible still
possible.
And somebody hanging on one leg, and he can still throw, right?
Yes.
Like Roethlisberger used to be, and like some of these used to be. But like, as a Niner fan, I would say that Purdy can't get away with that.
No. Nor did you ever see Tom Brady do that.
No.
Ever. Tom Brady is exactly like you said. Ball's up, stays up. It's always up.
Yeah, and it's getting out before he comes touches me because I don't want anybody touching me, right?
And if they do touch him, then they create a rule around it. You know.
Yeah. Well, everyone in the offensive line gets fired, and then we get new lines next week. That's the only rule they have. No, but I think that goes back to some of that stuff we see, like is like what's non-negotiable there. But it goes back to like that is a negotiable play because they have the body type to back it up.
Yes.
Whereas somebody else like Kyler Murray or Brock Purdy or some of these other guys who play at different styles of play, it's okay. But when it comes to actually throwing, they actually do hit the
they have to.
They hit the non-negotiable thing.
Yeah, and there's a way where it looks good and you know on script, and then there's like okay, now things have broken down. You got to get creative and things. Maybe some of the rules change. So it's like you know the rules, you follow the rules until it's time to break the rules.
Yeah.
And then,
because I mean, we've talked about Mahomes before, and I just, when you look at Mahomes, like as an athletic assessment, you know, like I haven't evaluated him and never worked with him, but just looking at him from a distance, seeing him play, it looks just like a disaster, but it doesn't look great. Like there's a lot of risk, you know, like tons, like the way the knees move and the way he moves and the way there's a lot of risk.
But if you've seen videos of how he trains, it's kind of interesting. His trainer is just putting himself in those positions
so he can
stabilize himself over again. Yeah.
But he has a piece of him he's so elusive because of this kind of chaotic look.
Yeah.
That I think defensively people don't get a clean look at him very often. You know, he's so quick, so shifty, so elusive that for him that works.
Mm-hmm.
But if you told like Brock to play like that,
it would never work.
Yeah, I mean it would be a disaster. It wouldn't work.
Yeah.
Right?
Yeah.
And that's what makes it so. That's what makes sports so fun. You know, and I think as clinicians, we have to be careful.
Yeah.
This is the whole conversation, is not to put people in like a purist box.
Right.
Where it should look exactly like this.
Yeah.
We got in trouble with that with squatting, with hinging, with everything.
Yeah.
And including like how you play.
Right.
Well, I know specifically with quarterbacks that there's a lot of, how Tom Brady trained, which I think gained a lot of traction a little while ago, has been completely transformed again. I think, Hurts kind of basically is the anti-Brady.
Sure.
Brady was doing all these kind of acute recovery exercises, and their Brady's, Hurts is squatting the house.
Yes.
So I'm seeing a lot more quarterbacks trying to get like as jacked as possible. They're trying to become the strongest, most powerful athlete on their squad.
But two very different styles of football. So Tom Brady's job was to never get touched. Jalen Hurts, the one thing he does on that team, is they do the tush push. So his job is to actually drive these 350-pound dudes forward. So Tom Brady couldn't do that. He didn't have legs to do that. So he trained differently.
It's true. But look at in the Brady era, everybody remembers Brady, but Peyton played the same way. Yeah, Peyton couldn't move out of the pocket at all, and he was phenomenal. Right, they would go head to head all the time. And then Rodgers is in the same category. I mean, these three guys like played very, very similarly. Pocket passers, phenomenal everything, phenomenal footwork, phenomenal game IQ, all that stuff. Whereas now the top 6-8 guys in the league all are like Mahomes, Mahomes, Hurts, Kyler Murray. They all move. Josh Allen, they all move, run, they're contact versus a different breed, different kind of football. But if someone could still be effective as Tom was, like Tom's, but I agree that thing about Tom, like doing all of the like rehab stuff to train. We've talked about that before, and Mahomes the same way.
Yeah.
I mean, I know Ian's worked with him a lot, so I know his program extensively, and Mahomes does that stuff 4 days a week, and then he lifts the house on Friday.
Yes.
So he still does the heavy stuff as well, but
I mean, he's huge. Like he's a big person.
He's a pretty good sized dude. Like,
yeah,
big hands.
He's
and
a
everything.
big guy.
Yeah, he's well built to the legs and stuff. Like, for sure. But all of those guys have phenomenal strength bases. Like that's what people forget. Like,
well, by the time they've gotten to that place, they have to have
their
high school weight room, their college weight room. Tom Brady's in college for 4 years. Lift at Michigan, probably lifting the house.
He didn't look great at the combine, but you're right. But still, he still has the years of experience and 20 years in the NFL, right? That he's kind of built up strength. The biggest error I would see is that if a young kid saw Mahomes' workout today, or he saw Brady's workout, the TB12 stuff, which I have no problem with it whatsoever. But if you're 14 or 15 and you're trying to build yourself up to be able to play at the next level, that's not the only thing you should be doing, or certainly not probably and even 10% of what you should be doing. You have so much more build to do. That's what makes Ryder so successful.
Ryder's, Ryder went down to Oregon, and I asked him how it was. He said, "Oh, it's pretty interesting. They had 5 of us all line up at the 50, and no step 2, just like square up, get a horizontal stance. Okay, throw. Let's see if we can get in the end zone." Off of
Ian did the same challenge when he went to Miami.
Yeah, just like, here we go, just throw. And, talk about just good old-fashioned huck.
Yeah,
and
rotational power.
And they did a really deep analysis on his arm. They did internal rotation, external rotation, movement, total arc, and then they did external rotation, strength test on him to kind of see, 1, how far you can throw, 2, how well is your arm move, and how strong is the arm with their testing.
That's kind of impressive that they did that, because that hasn't always been the case.
How far did he break 50 yards with it?
Yeah, I think he said around 60. He got deep in the end zone.
That's a big boy throw for sure. But if you look at the way he plays and what he brings to the table, one of the reasons why he's so highly touted is that he does have a phenomenal strength base. Like his base he's very hard to tackle.
Oh yeah, he was just telling me he was doing a fairly easy squat at a front squat at 350.
Yeah, that's yep. I mean, that's a lift for like a 17-year-old.
Yes. Yeah.
But he's been big for a while. He's been strong like this for like 3 or 4 years. It's where a lot of guys just gain 17 or just like sticks.
Yeah.
It's really incredible. But but again, that's the way he's designed, right? So he uses his strengths to his advantage.
Yeah. Do you see the pitchers really strong? Like out of all the pros that you're working with, how strong are their legs?
I mean, I think variability again. I think that's not always the case, but I think it's in the tank. Like if they're at that level, there is strength in the tank, for sure. They've built it at some point. And lifting in baseball, when I played baseball, lifting was a long time ago. Lifting was, there were things you did and there were things that you could do, but it wasn't like pushed the way it is now. I mean, these kids are pushed at young ages, and they're pushing themselves at young ages. Middle school and high school kids lifting fair amounts of weight because it's all over Instagram, and it's all the people they follow and people they see are doing it. So it's I think in a really good way, the strength bases are being built sooner. And so you're having to get maybe into those kind of like acute phases, like you have to think about with Mahomes or with Brady, those things. You have to get into that a little bit sooner with some of them. Because some of them by college are getting close to maxing out some of the strength stuff they can do. Like some point in their college life, they're maxing out, like on a trap bar, if they're lifting, 4 plates, does it really matter that much to be able to add 10 pounds to that? Probably not. If they're lifting 4 plates, that's pretty good. We probably need to figure out how you're expressing that strength. Like how springy are you? How elastic are you? How can you take that strength and make it useful rather than, grind for 6 weeks for 10 more pounds? So I think there's a lot of guys much closer to that max point at younger age.
No, I can see in football that there's still, especially like the quarterback still follows the same program more or less as the middle linebacker. So they're still doing, front squats, RDLs, power cleans.
Sure, yeah.
Now, do you see are the baseball guys pushing really hard into Olympic lifting progressions and front squat RDL progressions, or is it split squat?
There's very little Olympic lifting in baseball. It's a trap bar, it's a split squat, and it's a front squat. Those are their 3.
So that seems to me like the sweet spot of like, pretty good safety and phenomenal power.
It's keeping them just like a compressed elbow positions. Yeah.
And if it's in basketball, you can't put like a skill athlete like this at risk of hurting a wrist or hurting a finger doing a power clean or Olympic lift. It's just the risk isn't worth the reward.
Yeah, agreed. And there's a lot of VBT. So even in high school and college, these guys are using the velocity-based training, those cords, I think really effectively. I think it's a great way to start transitioning into that speed power phase. And it's good feedback. I think you guys like that a lot.
Let's talk a little about some throwing programs. Like, all right, that's the clearance. So let's jump into like, all right, what do you do now? Like, how do you get started with the throwing program? And then how do you progress that? There's obviously been a long-term camp that I grew up with, a distance-based program versus like a velo-based program.
Yeah,
as well.
And I think we've kind of overlooked this a bit, maybe as PTs or as clinicians in general. And there's definitely people that have done this well forever, but I think we've sort of overlooked throwing and the amount of stress that it is. And the amount of buildup that it takes to start a throwing program where you're throwing the ball 30 feet to end a program where you're throwing the ball as hard as you can. And I don't think it works to just hand them a piece of paper and say, here's your throwing program. We've passed. Go do this. Good luck with the rest of your life. I think that doesn't work at all, actually. So if you think of it this way, let's just take like a Tommy John rehab. You're going to start throwing in that 5 to 6 month window after post-surgery. You're not going to compete in a game until like the 12+ month window. So if you hand them their program and say good luck, you're skipping out on a huge amount of stress adaptation that has to happen. And there's 2 different research articles that I've found that talk about this, and I see this all the time. We talk about this at SSC, but there's a point, and it's almost like 10 months out of that surgery where something kind of goes wrong. Like you're going to end up. And these research articles say that's the most common point in time for having to like rework their program or redo something because something goes wrong, and that's 10 months out. So if I've handed them a program at 6 months and said good luck, I'm not carrying them through. So I think we could all do better about feeling confident carrying people through start to finish on the throwing program. So I think it's a huge amount of stress for them to adapt to.
Absolutely.
So that's step one.
Yeah, so many variables.
So many variables. And the other thing about handing them a program is kind of like we were talking about, a little bit earlier with the back thing about, you're following what they're telling you, following what their body is giving you. Without them coming back and you talking to them, you don't know how they're adapting to this stress. So I think following through with them on this is important. And it doesn't mean you see them weekly. You can see them every couple of weeks. It's okay to be less frequent, but you got to follow the process. Then you said something about distance-based programs. That's what it's traditionally been. And I think that can work, of course, as we've seen it work for decades to some degree. But I think we start to miss the mark, especially with higher level throwers with something like that. So there's this device. It's called a pulse. It used to be called, I think it was called a Motus sleeve or so. It was called something else, and then Driveline bought it, and they call it a pulse now. So it's a sleeve you put on your elbow. So it's like halfway down your forearm to halfway up your bicep. And it's got a little sensor in it, and it's reading your elbow torque with every throw that you make. And so it's got this measurement in there where it's looking at their acute to chronic workload. So it's giving you a ratio number on that, and then it gives you their elbow torque with each throw. The elbow torque number maybe not comparable to others, but at least comparable to them. And the acute to chronic, again, kind of comparable for them.
So it's got a strain gauge at your UCL location?
Yep, on the inside of your elbow. That's pretty. It's kind of a neat tool. So we've done this at SSC with Ryan Matthews, an Optimum Athlete tonight. We put 2 guys out there playing catch with these things on, going through a distance-based program together, and have proven that 2 guys throwing the same distance are going to have completely different strain gauge on their arm. So it's actually, we're saying distance as the measurement of intensity, but I think we're missing the mark. So our variables, just like in strength conditioning, volume that's number of throws. So we've got that. We can calculate that and figure that out easily. But then I think when we get into intensity, we kind of need some different tools in our bucket. I think distance is one. I think RPE is another, but we all know, like, especially with the youth, like that's probably not going to work that well. But
Especially in the early phases.
But when you get to higher level throwers, the RPE can be amazing. I have a great story on that. And then I think velocity is another nice tool. And velocity has become way more accessible to people. There's a little thing called a pocket radar. It's smaller than your cell phone. It's like $250. If the kid you're working with doesn't have one, their teammate does, their friend does, somebody they know has this. So I think most people have access to this in some way. So I think we have to think about throwing and probably think about it a little more comprehensively. So we've got volume as our number of throws, and we've got these different ways to measure intensity. And I think utilizing all of them over the course of a throwing program is probably the right idea. So you can take your normal distance-based plan, and then if once a week we get them in front of a radar gun so we can have an idea of where they're at, what that number is. We've got this beautiful chart laid out with percentage of effort, and then take the top end velocity they sat at before their injury, which they all know that answer now, by the way, like down to like decimal points, because it matters so much to them. And we've got that all laid out, so I can tell you, like, if this kid topped out at 85 and we want him at 60%, I can tell you exactly the range that needs to be.
And really what they're doing, if you say throw at 120 feet, well, like 120 feet could be like, with a very shallow arc, or it could be with like a decent arc. And that's the speed difference.
Yep.
And arm action, arm angle, all that stuff.
Yep.
Grip.
Yep.
All that matters, but we'd never been able to really measure it so much in the past,
Right.
We talked about this before. I really liked using like a distance-based programs, like for the youth especially, that maybe don't know how to kinetically link so well, where at least like, hey, if they have to throw it 120 feet, then 150, and then eventually 200, and it's always been a thing back in the day. Is like, can you throw it 300 feet? And then if you have to throw it 300 feet, you got a great arm, right? And then that usually correlates to you have pretty high velocity as well. So I like it for those guys, but like we were just talking about with the football guys, for the pros, it doesn't make as much sense by any means. Or more developed athletes doesn't make much sense because we already know they have the foundations and the fundamentals to throw that far. So I'm forcing them to throw that far again. It's just like
But the high school kids are throwing over 90 now. So I think even the high school, college kids, we kind of have to start moving towards this other realm, truly. But how they regulate that themselves is completely different. So, had this Robert Stevenson played for the Angels now. He was going through his Tommy John rehab, and he was supposed to his velocity range for the day was 67 to 68 to 72. So we told him to be able to throw, and he said, okay, just bring the gun out, just tell me the first one, and then just only tell me if I'm outside the range. First one he threw was 70 on the nose, and then every throw after that, I think he made 30 more throws, was within 1 mile an hour up or down. So he was like just so dialed. And you do the same thing with the high school or college kid, and you have to constantly tell them, they're missing by 5, they're missing by 7, they're missing by much more. So you're right. The younger guys are not as auto-regulated from that standpoint, which is where that's probably even more valuable for them. So a guy like Robert, he just needs to know the number once, and then it doesn't really matter. He can do most of his catch play and hit the numbers you want him to hit without even looking. But like the dangerous ones, I think, are the high school, college kids that are throwing hard. They're much more advanced at that age than they used to be. They don't have the auto-regulation of those.
It seems like you're still doing both, though. It seems like you're still doing distance with velo.
I think
you're building out.
Right. Yeah, I think using both is right, and RP. I think using all of those, kind of blending all of those together. So again, you don't hand them this program. You maybe keep that distance program, and you write out here's your next week or here's your next 2 weeks, included with some velocity, included with some feel stuff in there too. Then they come back and you talk about it. Okay, do we keep going, or do we stay where we are, or do we have to backtrack or whatever? And I think that's how this goes. That's how you miss some of these dips and divots.
I think the RP is really interesting because it kind of tells a little more of the kinetic linking. How easy is the kinetic linking feel to you?
And just like with a lift, so like you show up at the gym one day, you're like, man, this squat feels heavy today, but it didn't last week. That still matters. So that's where these things act like guardrails, kind of. We just got to keep you in line, rather than like this rigid program that you have to run. One point back to what you said about the distance. Now that we're talking about in baseball, they're talking about all these different ways to hold the ball and spin the ball. The ball travels very differently for some of these guys. So if it's a guy who backspins the ball super well, that's going to carry. So 300 feet might just be flicking it for him. But if the other guy throws like the sinker, the two-seamer that's moving more like horizontal or more down, he'll never be able to throw a ball 300 feet. So the distance...
That's been my problem the entire time. I didn't realize that.
Yeah, you're a sinker ball.
I did. Yeah.
You didn't know it.
I kept trying to break 180.
Wrong.
All right, thanks for clarifying that.
Yeah, glad I could help.
But if you're velo, you might be closer to like a knuckleball guy like Tim Wakefield. Just throw it about 62 every time. Did you didn't do the test?
Oh, hell no. They all wanted me to do it. Like, no way. Bad chance. I would be the guy that would throw the arm out. No way. Sputtering 49 miles an hour. It's like, it's no way.
Well, this is good. We'll have a throwing program, like kind of maybe some of these examples and kind of what Evan's talking about laid out a little more in a blog on the website, so people could read that and reference that a little bit more. Because I think it's a really important topic, super, super important. I think as a clinician, for those other clinicians out there, becoming a coach of this, and as Evan's saying, like really managing through the process is important. We'd say the same thing about like if you're managing an ACL.
I think it's every sport.
Yeah, no matter the sport.
You have to.
You have to manage the reps as they get into the activity. So it'd be throwing program or return to practice or return to sprinting or whatever. This is something that we really take a lot of pride in at KIME is taking somebody from like, all right, we can get the basics, get the fundamentals built, and then can we take you back to your sport and do it in cohesion with your coach or with your strength and conditioning coach, and working together with these people to kind of really, really bridge that gap. That's where the magic really happens. I feel bad that most therapists in most places don't get a chance to actually work with people that far into their return to sport. And I think it's a tremendous disservice for the athlete, for the community, and then for the profession.
So at month 6 to month 12, you give the throwing program, and they're coming in every 10 to 14 days. What are you checking? Can you do like a check mark besides that they're hitting their numbers with their guardrails of RPE? velocity and distance, and maybe type of throw. Are you doing you're not off the mound yet, So you have your throwing program. What are you checking each time they come in?
Yeah, so it's how are they feeling? So it's it's those questions, everything you just said, and then it's also like, what do they look like? Then there's some things you can't cheat, right? Like when the arm breaks down, we know what that looks like. Like if their flexor mass is breaking down, you put them in extension, elbow extension, wrist extension. That's going to be tight. You can feel the tissue. You can feel tension in the tissue. In the shoulder, you see them start to lose overhead mobility. You see them start to lose that across body mobility. You'll see them start to change the amount of total arc that they have. If you start to see those numbers changing, then you can see the stress happening. Even if they're not telling you, you can see the stress happening. You can see that you have to make some
So you're looking at
sometimes you're okay with that. And sometimes your role is, okay, we're pushing this. Good, we're adapting. You're not in pain. You're adapting. Let's clean up this tissue. Now you go do it again. Now you go back for your next 10 to 14 days. You really run into problems if they're having a hard time getting the stuff that you've prescribed done because there's too much of that happen. You know it's going to happen. But as long as you're seeing them enough to manage it, the amount of stress that their body's changing to, then all is good. But it's going to happen. Like they're going to start to lose some motion from this because you're asking them to go from not moving this arm fast to the fastest human movement possible.
Are you also poking at their new UCL? Are you doing a valgus stress or extension overload?
Yeah,
kind of probing that.
Yeah, you can see that. I mean, if they're complaining, you'll do those tests. But you would always put them in extension. You kind of always bounce them into extension. You'd always put them in layback position, which puts a valgus stress and stresses the shoulder if we're talking about a shoulder problem. So yes, you put them in the position.
Will you test their strength at all?
Yeah.
Will they weak? Do you ever see that? Or are you kind of mindful of that?
Yeah, definitely mindful for different reasons. I mean, I don't have a set time that I'm going to do that, but I'll definitely go back and test those as we're going for sure. I wouldn't say you do it every 2 weeks or you do it every this, but you for sure test that. Yep. Just like the kid I was talking about earlier with the nerve damage. Like if you weren't testing that, you wouldn't know that things were changing. Other than that, he had a giant divot on the back of his shoulder.
Awesome. Well, this has been a great episode. Thanks, Evan, for joining us. If you guys have any questions or you want to connect, feel free. You can comment down in the comments. You can send an email to KIMEcast@KIMEperformance.com. You reach out to us directly on Instagram as well. But we'll look forward to following up and feel it in your comments.